Are you frustrated because you don't know who to call for a loved one? A lot of times people will call many different agencies, and if they can't help you, they will just give you another agency to call. Hi, my name's Portia Vogt. I'm the owner of Golden Care. Today we're going to talk about the difference between home health, home care, a registry, and hospice. Number one, registry versus home care. So a lot of people get confused between the difference of a home care agency and a registry. The main difference is a home care agency has all of the insurance in place. They have general liability insurance, workers' comp insurance. So if anything happens, let's say the caregiver might fall and get injured in the home, the onus is on the agency. Whereas in a registry, they 1099 their workers, they're all contractors, and they don't have the insurance in place. So the onus falls on the family. The risk in general for registries is that they don't have employees, they don't have the insurance in place. And so if anything does happen, the onus is on the families. One example is if a caregiver gets injured, they can sue you and the onus is on you. Whereas if you're with an agency has all of the insurance in place and the onus would be on them, being the employer. Number two, home care agency versus independent caregiver. A lot of people wonder the difference between a home care agency and hiring an independent caregiver. So going with a home care agency, they have a pool of caregivers. So let's say if a caregiver calls off sick, they can replace that caregiver. Or if a caregiver goes on vacation, they can replace a caregiver. Whereas if you hire an independent caregiver, you can't. This is a common misconception. And here's an example why. If an independent caregiver gets injured while taking care of you or your loved one, the onus is on you. This is very similar to the registry example that we just spoke about. The main difference between a home care agency and hiring an independent contractor, when you hire an independent caregiver, you become the employer. So as an agency, we do background checks, TB screening, they're licensed, bonded, and insured. As an agency, we provide ongoing training to ensure safety of our caregivers and our clients. We also have specialized training. So if your loved one has MS or dementia, our caregivers are equipped to meet the needs of you or your loved one. Number three, home care versus home health. The difference between home care and home health is that home health is on the medical side of home care. So they have a clinical staff, which are occupational therapists, speech therapists, and physical therapists, and they are covered by Medicare, whereas home care is on the non-medical side, and we are not covered by insurance. One of the common misconceptions is if you have home health, you don't need home care, but this is not true. Home health will send out an occupational therapist or a speech therapist maybe 1 to 2 hours a week, whereas most people will need 6 hours a day or around the clock care. Number four, what is hospice? Hospice has a negative connotation around it, meaning when people hear the word hospice, they immediately think death. The goal of a hospice company is really to make you feel comfortable and relieve any pain that you may be having. So one important thing to know is that you can graduate off of hospice. We have had many clients where they are on hospice, and then our caregivers help to get them back to walking and being healthy, and they graduate off hospice. It can be very difficult and challenging to navigate through all the different choices of care. We are here to help you, whether you go with us or not. We have all the resources and tools available for you. To learn more, go to our website at getgoldencare.com.